lumbar plexus. It is an important plexus. It is formed by spinal lumbar nerves number 1, 2, 3, and 4. They arrange within the substance of psoas major and gives many branches. The branches emerge from the front of psoas major as genitourinary nerve, or emerge from lateral side of psoas major as iliohypogastric, or from the medial side of psoas major as obturator nerve. Some branches are inside the psoas major as to supply psoas major, psoas minor, quadratus, lumborum. Here, the branches of the lumbar plexus: iliohypogastric, ilioinguinal, lateral cutaneous nerve of the thigh, femoral nerve, genitofemoral nerve, obturator nerve, and lumbosacral trunk. Then branches which emerge from the lateral side of the psoas major muscle, they are iliohypogastric, ilioinguinal, iliohypogastric nerve. It supplies some of the anterior abdominal muscles and skin above the inguinal ligament. The other branch is the ilioinguinal nerve. This is the ilioinguinal nerve. This passes through the superficial inguinal ring and supplies skin on the upper medial part of the thigh and skin over upper part of the scrotum. Then we go to the lateral cutaneous nerve of the thigh, and it passes behind the lateral part of the inguinal ligament to supply the lateral side of the thigh. This site is called trap site. Lastly, the femoral nerve, which passes behind the inguinal ligament to supply structure on the thigh, muscles, and cutaneous. Again, the branches of the lateral side of lumbar plexus: iliohypogastric, ilioinguinal, lateral cutaneous nerve of the thigh, femoral nerve. Then, from the medial side, we see the obturator nerve that passes through the obturator foramen to supply structure on the medial side of the thigh. And lastly, the fourth lumbar root for the lumbo-sacral trunk that descend downwards to supply the sacral plexus to share sympathetic chain or trunk in the abdomen. It is the continuation of thoracic part of sympathetic trunk. It is formed of 4 ganglia. Its branches are rami communicants, whether white or gray rami communicants, and other branches are called lumbar splenic nerves. Lumbar splenic nerves. Autonomic plexuses. We have celiac autonomic plexus, aortic autonomic plexus between the superior and inferior mesenteric arteries surround the abdominal part of the aorta. Then we have hypogastric plexus. The upper is the superior hypogastric plexus and the lower is inferior hypogastric plexus and the pelvis. See the text for details. Another diagram to see the celiac ganglion and the celiac plexus, and then the aortic plexus of autonomic nerves and the superior hypogastric autonomic plexus. The kidney is an important organ in the abdomen. We discuss its shape, describing it is being in shape, having an upper ball, lower ball, lateral border, medial border, and 2 surfaces, anterior and posterior. Its size is about 12 centimeter, 6 centimeter, and 3 centimeter in thickness. Site of the kidney. We see the kidney lies on the posterior abdominal wall on paravertebral gutters, extends from last thoracic vertebra to third lumbar vertebra. The left kidney reaches up to the 12th rib, while the right reaches the 11th intercostal space. The kidneys lie obliquely. The upper balls are nearer to median plane. the upper ball away from the median plane by about 1 inch. The hilum is about 2 inches away from the median plane, while the lower poles are 3 inches away. Hilum of the kidney. The kidney has the hilum on its medial border, which contains the important structures that pass to the kidney or out of the kidney. They are renal vein, renal artery, and renal pelvis. They arrange renal vein anteriorly, renal artery intermediate. The pelvis of the ureter is posterior. And downwards.